You might have heard of the Socratic method or Socratic questioning. The method has been around for about 5,000 years, so hopefully you have heard of it by now. But it's really important for you to use, especially in your Level 7 studies. And it takes the idea away from an expert on the stage teaching you, especially from the point of view of simply lecturing at you, which is more of a pedagogical style, to adult learning strategies, which we call andragogy. And therefore it's taking away the notion of the sage, the wise person, the sage on the stage, and putting somebody as a guide next to you, enabling you to walk the journey together using dialogue, discourse between us, so that we can constantly probe and go further with our questioning. If you've heard those terms about the Socratic method and Socratic questioning, maybe a good way to explore the difference in those is that one is to do with being the recipe, the method, whereas the questioning would be the individual ingredients. Now, applied to adult learning, to andragogy, then it's really clear how this taps in so well to your level of inquiry, constantly trying to understand more, seeing different perspectives, being able to critically analyse, not just the subject matter, but the intersectionality of all that's going on around what you're exploring. So it really taps in well to adult learning theories. And here's a great example, especially from a courtroom session by a person called Dr. Dobson. On her website, verywellmind.com. Just let me read through some of the sentences here of questioning. So Dr. Dobson was asked, can you explain to the jury how trauma forms? Can you provide an example? How do you know this is true? Do you have data? If this is true, what does it mean for a person who also has anxiety? If it's not trauma, what else could it be? And why does talking about trauma matter in this case? Now, notice how I pause just for a couple of seconds in between each of those questions. But in good Socratic style, when a person poses a question, it's great if you've got at least 30 seconds in which to consider your answer. So you're not necessarily giving gut reaction first answer that pops into your mind, but you've got time to consider it, to explore it, and to think of it from different perspectives. Now, obviously, in a courtroom setting, that may not be realistic at all, but in our educational setting, that certainly can be. So the greater experience you get of thinking like this, then maybe the 30 seconds would be a really long time for you, but at least having the opportunity to think that way as you're practicing and rehearsing this Socratic method. So Socrates came up with 6 particular questions which are really relevant to us here. And the way in which I've processed these for the remainder of the slides is to give you an example of each question in relation to police custody healthcare settings and for those of you working in sexual assault referral centres. So the first question is around clarification. It's trying to understand exactly what the situation is and what's being said about it. So why did a person give a particular response? And how does that relate or not to the situation or the question at hand? Look how sometimes, dare I say it, politicians, you might ask a politician a question and they'll answer something totally different. Now, why are they answering differently? Is that just to deflect? Is it because they want to talk about their issue, not the question being asked? So it's drawing them back to the question. It's to give greater clarification on it. Now, in relation to both your practice areas, let's look at this one from a police custody point of view. What led you to conclude that the detainee has capacity to consent? Okay, that's the important thing there, that they have the capacity to consent to a particular form of examination, which in this case is going to be an intimate one. So what sort of assessment have you done of the detainee that's led you to decide that yes, this person has the capacity to consent, not just to having their blood pressure taken or to having a blood test done, but to an intimate examination? So what's given you the evidence that you've come up with that conclusion? In relation to a SARC setting, again, think of the implications of this. If you're telling a court, for example, that there were no signs of visible injury in regards to the genital examination that you did, what's the implications of that? Are you implying, well, if there's no signs of injury, therefore nothing happened? Are you implying that? Or are you implying that, well, injury, such as bruising, for example, may show later? It's all according what the evidence is that you're presenting and what you mean by the very utterances you give. Then this one on challenging assumptions is very much a case of don't judge a book by its covers. Okay, so you may make an initial assessment of a person, but how do you know that initial assessment is true? Because it may be an assumption. It may be prejudice, prejudgment. You may think, well, I've seen this sort of behaviour before. Now I'm seeing it again. They're stereotyping. And therefore I can make a judgment on this because I've seen it before. There's prejudice, prejudgment. And that's tapping into your assumptions. So it's challenging assumptions, both in yourselves, and in others. It could be that you need to challenge the patient or the client's assumptions, maybe of you or of why you're doing certain tests. Or it may be from the multi-professionals that you're working with. Somebody is making assumptions and it's really important to check those out. In a SARC setting, for example, look how many people may delay actually going for any sort of healthcare, whether it's going directly to you at the SARC, maybe going to an A&E department, maybe going to their GP. Why did the person delay? And look how, especially if you're using this as evidence, this is something that you may be questioned on, as in why you think the person delayed. Because an assumption could be that if a person delayed, they wanted to get their story right. So therefore, there's less credibility given to it. That's an assumption. But that assumption needs to be challenged. Likewise, supposing you're working with a person that you make an assumption they're only drunk, they're only intoxicated. But what else could be showing the signs and symptoms that they're actually displaying? Could it be something to do with a head injury? Could it be withdrawal from certain medications, illicit drugs, for example? Could it be hypo or hyperglycemia? What mental health conditions may make them stumble and stagger and be slurred? So it may appear at first to be intoxication, but not necessarily so. The third question is looking for evidence. So again, this is really important with level 7. When we use the term critical analysis, look how that means breaking everything down into its constituent parts. And you analyse each of those constituent parts individually and then see how they all relate to the whole. So you're asking questions here to prove a point, and it could be that the more you're trying to prove, the more evidence you need to gather. So even looking at different types of tests or examinations of a person, it could be that you're trying to exclude something. Say, for example, in that case of intoxication, what tests would you need to do to prove the person wasn't intoxicated? And if they're not intoxicated, what tests are you then going to do to try to discover what it is? Here, the proof is really in the pudding. Okay? Now, when it comes to mental health observations, for example, sometimes you're going to decide to refer a person on for mental health services. Other times you may be deciding not to. But what is it that informs that judgment? And how are you implying that decision-making process to other people as well. So are you being swayed by assumptions about different individuals that lead you to go down one path as opposed to another? It's questioning your actual decision-making. What decision-making skills are you bringing into consideration, and how are you supporting those with the different types of data that you're gathering around this? In relation to SARC settings, then you may be taking huge amounts of data. You may be making copious notes, doing different types of tests and examinations, but especially when it comes to presenting those, what's the crux of the matter? What are the main things you need to present? So you're gathering so much evidence in the first place, but then how do you extrapolate out of that to the findings that you actually present? What's going to be essential for presenting in a courtroom setting? The fourth one is looking at perspective. So not just from your own point of view, but how about walking in your client's shoes? Seeing it from their point of view. How about all the other multi-professionals that you're working with? They've all come in with their own opinions, and they've all got their own perspectives on this. So how are you going to be able to explore it from all these different points of view, and maybe taking a step back to see it from the other person's perspective? Now, when it comes to working in whichever setting you're in, it could be a case that the individual might see that you're not so concerned with them as a person, that you've lost this whole notion of person-centered care because all you're focusing on is the processing. You have to get certain tests done, you have to get certain samples collected, and you're just making sure that the process is progressing at a really good pace here. But it's important to make sure that you're constantly staying person-focused. Even if this means that you're going to explain step by step to the person why you're having to do so many tests, what's the relevance of them, and the benefit of them, so at least the person understands. You're not neglecting them or their emotions or their feelings. You're being with them, but at the same time, it's also important that you're gathering all of these particular data. Now, supposing a person is being detained and maybe they're at risk to themselves, maybe at risk of suicide. They've expressed some suicidal ideation. It's therefore important that you're going to be checking on them at regular intervals. But from their point of view, they might be completely and utterly exhausted. They may be saying that they haven't slept for a few days, and all they want is a good night's sleep. And all you want is you need to be checking in to make sure that they're still alive or that they're still safe. Again, an explanation goes a long way here. So you may say to them, well, look, you've explained to me how vulnerable you are feeling. It's therefore important for me to check in on you to see how you're doing and that you are safe. So I will be looking in on you. At least you're giving them that explanation, and they're not going to become anxious then, just thinking, well, why doesn't that person leave me alone? Why are they constantly checking on me? So it goes a long way then to explain this to the particular person, but that means that you've considered it from their perspective. Question 5 is on discovering consequences. It gives you the opportunity to think of a topic, again exploring it from different angles, as with the court questioning of Dr. Dobson that was mentioned earlier in this video, when Dr. Dobson was asked, well, if this isn't trauma, then what else could it be? Or how would anxiety impact on trauma? So therefore, you're not just looking at one dimension here, but you're considering other dimensions as well. And as we've looked at across the programme, looking at ways in which the intersectionality of the person is different. Say, for example, in perception of pain. Look how some healthcare professionals consider that certain individuals, because of their ethnic origin, for example, perceive pain differently. Now, that's an assumption. It's also a prejudgment, a prejudice, and it's also being very stereotypical. So here, discovering the consequences might also mean discovering the consequences of the answers that you give if they're not being considered from various perspectives. In relation to fitness to detain, for example, supposing as a healthcare professional you're working in a busy police station and you feel that on this occasion you're being rather rushed. If you're not being totally complete in the way in which you apply this, then that means it's not being applied equally to everyone, which is problematic in itself, but also the case that you may then be leading to a case where the patient is not so safe, or decisions are made around detention which are not based in the full, dare I say it, in the whole truth. Okay, so it's only partial truths being gathered if you're not making a proper fitness to detain assessment. In relation to SARC settings, and again we'll explore this when you're developing your witness statements as well, look at the difference between just stating facts and bringing in clinical opinion. But when you're bringing in that clinical opinion, you are part of that clinical decision making. So it's important to focus on that you're making informed clinical opinions and they're not being impacted by your own personal prejudgments. And finally, the last question. This shows us how we constantly need to keep on questioning and questioning the questions. Okay, so probing constantly behind everything that's said, because you're not just taking something at face value, you're exploring it from different angles, but even then wanting to go back even further to explore that in greater depth. It gives you the opportunities to think about it, and especially when you're having to make decisions. So what was the rationale for a decision taken? In relation to custody settings, supposing a person is brought into you who's been restrained and maybe a certain amount of force was used in that restraint. So it could be that the patient's complaining to you about the amount of pain that they're suffering, or you might see physical marks of that restraint, or bruising, for example, and you're now questioning. So you're questioning the patient about it, how they feel, how they're experiencing this. But then when you're questioning the officers, look how they look at it from their perspective as well, how they might think, well, are you asking me these questions just to apportion some blame here? So it's explaining to them why the questions need to be asked, so that you're constantly exploring all the different angles. So what was the rationale? What was their first decision which led them to use the amount of force that was led? Trying to understand it as fully as possible. In relation to SARC settings, again, it could be that you're working with a new colleague who may be looking at the client before you, and supposing the client is coming across as being rather distressed at all the questions, at all the tests being done. So a gut reaction maybe, or do we need to do all of these now? So you have to show how important it is, not just for gathering the forensic evidence, but for the client's safety and well-being. So it could be that you're doing pregnancy testing, or sexual infection screening, HIV screening, other bloodborne viruses. So you're gathering all of this evidence, which may seem a lot to be gathering when a person is in distress. Again, looking at being person-focused with them, reassuring them and showing them how it's in their best interest that you carry out all of these particular procedures. And that's it. So in looking at the 6 key Socratic questions, and you'll see more on the individual Adobe Express page accompanying this unit. So look at those questions. Good for you to be able to ask and reflect upon them yourself. But obviously in a true Socratic method, this is dialogue between 2 or more people, so that you've got somebody who's a guide on the side to be able to ask you these questionings. Great if we can carry on this in practice, doing this live when we're meeting in class, but also think about doing it in informal groups, maybe you've got a WhatsApp group, or those of you in the Met Police Service, when you're meeting together, try getting into this Socratic style, and certainly then share your learning with us on Moodle, on the forum sites, to show how you're applying this and how beneficial you are finding it. Thanks.